Good morning. We are delighted to have joining us today Steve Barsh, who is the managing partner, one of two managing partners at Dreamit. He'll tell us what Dreamit is and how they've been managing during this particular pandemic. Joining me, as always, is my colleague, Professor Raghu Iyengar, who is an esteemed professor here at the Wharton School. He's also the director of Wharton Customer Analytics. Let's get started and begin with Steve. Welcome, as I say, and can you give us a little bit of your background, how long you've been doing what you've been doing, and help acquaint our audience with Dreamit?
Sure, thanks for having me. So a couple of things on my background. I've been a serial entrepreneur and turned investor for my entire career, now spanning 30 or 40 years. I started doing software development when I was really young, went to University of Michigan, got a computer science degree and specialized in an area called software engineering, and started my first company in my senior year of college, built that up, bootstrapped it, sold it 7 years later, and then did another and another and another. I love early stage startups. Along the way, I got a sweat MBA. I don't have a real one. I just have like 30 or 40 years of experience of building and selling companies and financing them. I taught at Wharton for 3 years under Len Lodish, part of his GCP program, which was extremely rewarding. It was a lot of fun. So I have a blend. I have both a very technical background and a business background. I joined Dreamit about 5 or 6 years ago. I love working with startups. I love helping them see around corners. I love funding them and investing in them and helping them build up to be even stronger and better. So that's my passion, is all around startups. At Dreamit Ventures, at the end of the day, we're a venture fund. Our differentiator is we have a growth program. So before we actually invest in companies, they go through a growth program with us that lasts anywhere from 3 to 6 months, where we accelerate both their customer development and customer acquisition, as well as their funding. Companies that come into Dreamit, two core areas that we focus on the most these days are health tech companies like digital health, medical devices, that type of thing. And then something we call secure tech, which is largely cybersecurity, but goes wider than that. It's physical security, anti-fraud, anti-money laundering, all kinds of things in this big umbrella that we call secure tech. And companies that come in are pre-Series A, they have product, they have early revenue, and we're looking to invest and make them bigger. We're based out of Philadelphia, New York, but companies come to us throughout the United States, Israel, and a couple other countries around the world.
So Steve, there are certain industries that their impact throughout this pandemic has been very, very visible. It's less visible to those on the outside how the startup industry has been affected. Has there been a surge, or has there been a decline? As the flow of ideas in startups coming to you gone up or down during this period?
I'd say probably net, it's about the same. We'll talk about startups coming our way, and then startups that are already Dreamit startups that are part of it, that are already part of the Dreamit family that we've invested in or we're working with. Let me just start with the latter, companies that are already part of Dreamit. So there's part of Dreamit. There's hundreds and hundreds of companies that we've worked with over the last 10 or 12 years that we've been doing this. I think for the lion's share of companies, again, focusing on health tech and secure tech, in the middle of a pandemic, you couldn't pick two industries that are more impacted during a pandemic, right? We have so many of our health tech companies that are on fire and raging because you have hospital systems that have to do a lot more with a lot less, and they need core solutions that can make a difference. So that's interesting. From a security point of view, I don't know if you've read or heard about things like SolarWinds and people being hacked and people thinking that elections are being taken over and voter fraud and all kinds. It's all security, right? So both of these industries during the pandemic have been massively impacted from a humanity point of view, from a negative point of view, from a startup point of view, a very positive point of view, because you always, when you build startups, as I'm sure you well know and your audience knows, you want to hit a pain point. And this is like going to the dentist and they're like, is that tooth hurt? And like, ooh, it's cracked and I've got a raw nerve. It hurts a lot. On the deal flow side, we've seen about the same level of startups. I think a little, now the pandemic being a year old and most startups raise about 18 months of cash. The startups we now see are a little bit more mature. I think some people kind of withered away because they just don't have the funding. But companies that had solid footing and kind of knew what they were doing are still doing well and still going strong. again, particularly in these types of areas. These are big pain point areas. That's why we like working in them. They're big industries. So there's a lot of startup activity within both of them.
No, great to hear, Steve, especially from the side of, entrepreneurs trying to get into healthcare and so on and so forth. So that's good news for them. Anything, especially in the last year or so, have you seen differences kind of building on what Dave was saying in the type of ideas that have come around, perhaps were not so in the year before, especially in healthcare, and more so now we hear about, lots of companies going digital. So clearly cybersecurity is a very big deal.
Sure.
Are these ideas in the last year somehow different from the ones you've seen before?
Different. I mean, we see a lot of people that try to paint everything, in the cybersecurity side, it's work from home, and in the health tech side, it's a COVID solution. And we see a lot of whitewashing. Oh, look, this is great for COVID. Yeah, but it's an ephemeral event, thank goodness, right? It's going to be over. Or they're just trying to wash something and like spray paint COVID on it and like think that that's magically going to make them be a great company. Or they've got a secure tech company and just magically, because of work from home, there's something. We are seeing great companies. We're seeing great thinking, but and people taking advantage. Like this work from home, this COVID phenomenon, which is very global, has accelerated cloud adoption. Right? There's more and more people going, we have to get to the cloud because everybody is not at home. I mean, everybody is at home. So, and there's a lot of secure tech solutions that are built for cloud type solutions and cloud migration. So again, we see a lot of different companies that this is accelerating them. At the same time, we see kind of like faux companies that they're just trying to whitewash, and we just kind of bypass them very quickly because they're just trying to sneak in, so to say.
So when I think about, cloud-based technologies and sort of the use of information, we see a lot of companies that are taking full advantage of that. I'm wondering in healthcare, there's so much concern about privacy of data and the ability to share data. So I'm sort of curious about some of the companies that you're working with about extra steps that they have to take to sort of protect that data and also to not share that data.
Sure, that's a great question. So first of all, in the health space, the companies that have been going through Dreamit have been dealing with HIPAA, which is the US regulation around health privacy. EU has different regulations, things like GDPR and other issues in the EU and around the world. They were already tackling that issue. HIPAA was already an issue. I would just say the big explosion that we've seen over the last year is certainly in telehealth, right? I'm going to ask, I'd ask the both of you, your families, people how many people do you know that did a telehealth appointment over the last year? It's gone through the roof, right? I'm not going to the hospital. I don't want to get infected. So we've seen that massive surge, and we've seen most of the hospitals, like a lot of the hospitals that we work with that are partners of Dreamit, all use a system called Epic, which is they don't all, but it's a dominating EHR, right? So Epic has grown their telehealth solution tremendously over the last year in maturity because they have that privacy solution. You saw certainly in the beginning of the pandemic, people using FaceTime and kind of non-HIPAA compliant things. We've seen that kind of buckle down. But again, most of our companies, all of them that are in the health tech space, were already HIPAA compliant, BAs in place, that type of thing, because it is a very sensitive issue.
So Steve, one of the things, again, from your perspective, especially at Dreamit, I would imagine that, when previously, again, I'm contrasting the last year with perhaps the years before. If I were an entrepreneur coming into Dreamit, you'll have a lot more perhaps face-to-face physical conversation, perhaps get people into a room, get people excited. How have your operations changed? Are you doing a lot more kind of online as everyone else is, or are you doing a combination? How have things changed?
Well, so right now everything is online. One advantage that we had in our program, so again, we work with a lot of Israeli companies, West Coast companies, the US. We already did things in a hybrid mode where there's a number of things we would use. We've been using Zoom for 5 years now. Like the Zoom craze, we were using it for a long time and already used to that for both us as a team and working with our startups. So we were previously doing some things face-to-face and some things over Zoom, and then we had to go full Zoom. Luckily for us, we're already halfway there. So it was like, okay, we're just going to convert everything over. And by the way, it's not nearly as good. I like being face-to-face with people. I like being face-to-face with investors, customers, and startups. But you do what you have to do right now. So the transition for us hasn't been too difficult. And again, even when we interview startups, we do these full team interviews with startups. even before the pandemic, 20% of them we would do in person, 80% of them we do online. I don't need a company to fly in from LA to Philadelphia to meet with me. We can do the meeting over Zoom, and we were doing that before the pandemic. So that hasn't changed too much. I just wanted to bring up one other point, though, from something you were asking before that has changed about online, in person, that type of thing, and just the effect on secure tech and health tech companies. I think one of the interesting things is one of the areas that we specialize in is we do something called customer sprints and investor sprints. And I don't know for your audience and for you, when you meet, we have very technical founders. A lot of them are like CTO type people. And we came up with that terminology just, because we'd always talk to them and they'd say, we need to do another dev sprint. We can't meet with customers. We have to do a development sprint, build the next version of the system. And we started to say, how about do a customer sprint? How about go get more customers? Because that's what's going to make a difference, or go get more investors. And I would just say that during this pandemic, what's really been interesting, so for our healthcare partners, the largest set of our customer partners are all not academic, but healthcare systems throughout the United States. And trying to get into a healthcare system right now, if you're a startup and like knock, 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 I'd like to come talk to you about my new solution. 9 months ago, it was scrambling for PPE. 6 months ago, it was a different issue. 2 months ago into now, it's like, we're busy vaccinating people. Yeah. They are so busy. It's right. One advantage I think companies like Dreamit, and there's certainly other people besides Dreamit, have though, is we work with so many startups and our partners trust us. Like, look, if it's a Dreamit company, we know you only accept about 3%. We know they're going to be great. So I think during these situations, one thing that we've adjusted our business model is the partners that we have an even closer relationship with our customer partners that work with us because they trust us. Like, look, we have so little time right now. We're trying to literally save lives like never before. We'll look at startups if they're going to make a huge difference, and we'll work with you and it's challenging because if you're a startup right now, and David, you were asking, for startups, what's the impact? What's changed? It's harder. If you're trying to get into the chief information security officer, the CISO that handles security of a large corporation, they're up to their ass and alligators right now. Everybody's work from home. Everything's distributed, everything. And it's so hard to get in because they're pushing harder than they ever have before. So it's challenging because we mostly work with B2B and enterprise type startups that are selling to other businesses. Yeah. So there's huge opportunity because there's huge need, but at the same time, a lot of those doors are closed because they're so maniacally focused on executing in a very unusual time.
So it's interesting that you would talk about that because we had as one of our earlier interviews the co-founder of Volano Vascular.
Mm-hmm. Yeah, sure, great company.
A great company, but they indeed are facing exactly the challenge that you're talking about. Mm-hmm. I'm going to shift gears just a little bit here in that one of the things that I have experienced is that when I talk to startups, they have a lack of information from their customers. And I'm wondering if you find that and how imperative you think it is that before you really try and launch your business, you have a lot of customer information and insights and what it is you do to sort of encourage that or insist upon that.
Sure. So it's a great question. Every startup that gets into Dreamit has those insights already, but let's go earlier, which is what you're talking about. Yes, I find it's a huge problem. And let me just do a 3-minute rant here. And for your audience, if they have a chance, check out the Dreamit Dose on YouTube, because we have a recording of this. We shoot these micro segments that are about 5 or 7 minutes long. This is one of the ones that we passionately talk about. I find that the vast majority of startups have a very poor understanding of customers. Mm-hmm. They spend a lot of time building a solution, but they haven't talked to customers much. All of this is documented well. As I'm sure you know, and I don't know if your audience knows, if you look at startup failures in the United States or around the world, it's a global phenomenon. We've worked with startups in Israel, Poland, South Korea, the United States, Canada. A global phenomenon is lack of customer knowledge and lack of experience with customers. And I just want to get back to, if we look at why do startups fail? Roughly, I think the statistics say 60% of startups fail because they're not solving a problem that anybody really has. Okay, that's a problem, right? And just so you know, we do a technique at Dreamit, and I'm very open about this, where we triage startups. We talk to thousands of startups a year, and we select very few. How do we triage a startup? Well, I'll just give you an analogy, and I'm going to try to answer your question. If I go too long, certainly cut me off. When we're triaging startups, it's a little bit like, you're at Penn, right? So there's hospital at the University of Pennsylvania. If a car crash victim comes in from multi-vehicle crash, comes in off the ambulance into the trauma department, not even the emergency department, trauma, it's really, really bad. And that person gets wheeled into the trauma department. Doctor puts their fingers on the pulse. There's no pulse there, and the body is cold. You're done, right? We're done. Don't need x-rays, skip the MRI, don't pull labs. They're like rigor mortis, they're dead. We're done. Just pull the sheet over, and unfortunately, we're done. That's triage, right? We triage startups all day long. The number one question I ask the startup, just to get back to your question, is what problem are you solving? What evidence do you have that the problem is big and urgent?
Yeah.
And the number of super early stage companies that we talk to that come back with a bad answer on that, it's not a good statistic, right? Well, we haven't really talked to a customer because we need to build the product first. Well, you need to do customer discovery, right? Because that, to me, I'm going to kill 60% of startups. I don't need to do how big is your market, what's the competition look like. I can skip all of that. No blood tests, no MRI. Don't even need to put a stethoscope. There's nothing, because 60% of them fail that test, right? They can't get through that. So just to go a little further on that, startups need to spend a lot of time talking to early customers. You don't need a prototype, just have a conversation. Here's the problem I'm solving. Is it big and urgent? The last thing, just quickly on it, is we encourage startups when they're doing that, go talk to people and tell them when you're talking to them, you have one ground rule when you talk to them. And your ground rule is you can't hurt my feelings. So the problem I'm working on, is it big and urgent? And if it's not, you're doing me a favor if you punch me in the face. I don't need this. I love Shark Tank. Go, that's great. Anyway.
Oh, great. I think this is great to hear, and also music to our ears. Being in marketing, we love to hear how important the customer is and finding the customer journey and kind of understanding the needs. So Steve,
can I put one more nuance on that,
Steve,
on customer journey?
Please, of course.
I'll ask you guys, and I'll ask people, let's just talk last thing about customer problem. Now, let's say you've discovered a problem and you're coming up with a solution, right? And then we talk to startups all the time. Not only how important is the problem, but how differentiated and how unique is the solution? Is it marginally better, or is it a lot better? Is it an order of magnitude better?
Yeah.
No, it's better. I was like, well, wait, it's better doesn't cut it. So the example I always use is I ask everybody to pull out their phone. Okay, so I'm going to pull out my phone, and it's an iPhone 11.
Yep.
So I don't know what phone's in front of you, but if you have an iPhone, and is that an Android, David, or an iPhone?
iPhone.
It's an iPhone. Is it? Are you both holding up a 12 Max Pro? What are you holding up?
I don't have the 12.
No, I have a much older one.
Okay, a 10, a 9, something, an X.
Yeah.
My point is, you have an X. Well, why haven't you upgraded to the 11 or the 12? And you're like, you know what? It gets the job done.
Correct.
It's good enough. And oh, by the way, I don't want to spend another $600. And I find startups all the time. I always say to them, pull out your phone. It's like, if your product is just marginally better, like the 12 versus the 10, no one's going to buy it. And Steve Jobs used to have a great line. Your product needs to be an order of magnitude better in some way, shape, or form. Whether it's you can win not just on product, but business model. There's other aspects. But if you're not an order of magnitude better, it's like a comfy pair of shoes. You don't get rid of it. And we find a lot of startups miss on that. Yes, it's a big problem. Yes, you have a solution, but it's like marginally better. And you're not going to break into the market with something that's marginally better, just like a marginally better phone. Anyway,
this is a great point, Steve. I want to give you a hug. I think that's a great point. Because that's exactly what we tell our students, that you need to think carefully about, obviously, as you can imagine, a lot more students and a lot more people that we interact with want to do the startups because I think it's exciting. But at the same time, to think carefully about what is the value that you're adding.
Right.
So Steve, I want to ask you a slightly different question and tell me if you've had experience with that. Is I hear a lot of bigger companies like the P&Gs of the world and many other bigger companies trying to also incubate startups internally.
Sure.
And of course, there are many other companies that are trying to disrupt what the P&Gs of the world are doing. Any thoughts and comments on that as you start thinking about these bigger companies doing incubation inside versus disruptors coming along the way?
Yeah, so some companies have innovation and incubation in their DNA. So I think we need to let's talk about big companies. Let's talk about two categories. Let's talk about the P&Gs, the Unilevers, and those types of companies. Let's talk about a different class of companies: Facebook, Google, Amazon.
Yep.
Right? Those are both big sets of companies, but they're different. I think the Facebooks, the Googles, the Amazons, the Apples, in their DNA is the type of innovation that we see today. They're not perfect.
Yeah.
They're better. I met the head of innovation, by the way, at Amazon a year and a half ago at a conference at NASA that we were both attending. He's VP of innovation. He's been there. He's got a very low badge count. I think it was like employee number 50 at Amazon. I asked him how many people are on his innovation team at Amazon. And I think it was like 3. I was like, wait, 300? No, 3. My job is to breed the culture of innovation at Amazon. If we're going to try to force innovation on Amazon by me having a big team, it's never going to work. It has to be baked into the people that work here. It's a very interesting point. Yeah. We've seen a lot of innovation efforts at a lot of big corporations, and generally they don't go really well. The team members, the employees that you hire are not usually wired for innovation. They're not wired for risk like a startup is wired. Typically, when you see young innovative companies coming out of bigger, older style corporations, the white blood cells come out, right? Which is like kill, not innovate. They tend to like kill it off. And you see, where does innovation, last little point, and tell me if this goes too far, Hilton Hotels didn't come out with Airbnb, and Greyhound and American Airlines didn't come up with Uber. You see wild innovation come from startups. That's why a lot of bigger companies almost treat startups as their R&D, acquire. But those are some quick thoughts on innovation from large companies.
Thank you.
In general, you've got people that are knocking on your door, begging you for take us in, but you also do some marketing. And I'm sort of curious, what it is that you do for marketing Dreamit, and how you get people to come to you versus going to somebody else that does something somewhat comparable. And has any of that marketing on your part changed during this past year?
Okay, so one thing, let me go what's changed, and then I'll go backwards. So let me take the last piece first. What's changed is we used to go to a lot of events and do a lot of public speaking at events and network and meet with startups. That's all gone, right? You do an online event, but it's not the same thing. That's been painful because we love events and we love getting out there. So that's changed because it's gone. And we do some of the virtual things, but it's not the same, but people are trying. Let me just talk about marketing from Dreamit's perspective and what we try to do. And I will give both to you and your audience just a bit of an analogy and a bit of my experience. Again, I've been a serial entrepreneur my entire career. And the number of times as a CEO raising money for a startup, I'd meet with an investor. And the investor would say to me, again, my role is now I'm CEO and I'm pitching for money. And they'd say to me, what makes you unique? What makes you different? What's your moat? What's your defensibility? What's your IP? What's your cost of customer acquisition? They asked me all these questions. And I always wanted to hold up a mirror and say, excuse me, what's yours? Like, what makes you so special? I mean, I know they have to ask me those questions, but like, what makes you unique, Mr. or Ms. VC? What makes you different? What's your cost of customer? What's your defensibility? I never did that because I figured it wasn't a great way to get a check, but it was a great way to be shown the door. We obsess, and I obsess about that question for Dreamit all the time. What makes us unique? What makes us different? What makes us attractive to a startup? So what we do from a marketing point of view, so we do things like there's Dreamit Ventures, and then we come up with terminology like customer sprint, investor sprint. Those are registered trademarks of Dreamit Ventures, LLC, right? We brand those, we name them, we build things like the Dreamit Dose. So we come up with this YouTube video series, which our audience, all organic, grew 550% last year. Just an audience on Dreamit Doses. We put out that content, and we put it out because we want to help startups, but we also want to show, like, people will say, when I hear you guys explain things like go-to-market strategy, how to differentiate competition, how to do channel sales, like in 10 minutes, you guys describe things that I've been struggling with for years, and it just all makes sense. So we use channels that align well with what we think are our differentiators, the way we talk about, explain, work with startups, invest in startups. So we've been pushing on our video channels and social more than ever. We try to differentiate what makes Dreamit unique, what makes us different. We push on those buttons all the time and think about how do we differentiate as a venture firm? Because there's hundreds, if not thousands, of venture firms in the United States that all have money. And when we talk to a startup, we always say, like, you should go to a value-added venture investor. How are they going to add value? We know how we do, and we work a lot on that, and then messaging around that from a marketing point of view.
Oh, thank you, Steve. So this has been a fascinating conversation. And as we are coming towards the 30-minute mark, I want to ask our last question, which is, obviously last year has been quite tough for everybody. And especially, as you've seen companies that have been pitching to you and startups and so on, what would be your advice to the startups that are, the entrepreneurs out there who might be working on it, or perhaps other people who are thinking about entrepreneurship, they haven't gone there yet? How should they navigate the next few months or perhaps the next few years?
I think not, so first of all, the world's going to come back. It seems like this fall, I'm not sure when people are watching or listening to this, but, around September-ish 2021, seems like things will, at least in the US, start to go back to normal. I think people need to be ready for that. By the way, if you're listening to this, we're recording this, March 2021.
Yep.
You need to be planning if you're a startup. So first, for your startup questions, you need to be planning right now for September, because 6 months from now, we have companies, the smart companies, that are like, I need to start raising because I need to start building my sales force back. It's going to take me 3 months to hire them, 3 months to get them on board and productive. That's 6 months from now. And oh, by the way, I need funding to do that. So I think for companies that are in it right now, they need to start figuring out their plans for fall 2021 and to get in front of that, because you're already about a month too late. For people just getting into it, to me, it's always a great time to start a startup. To be a little bit self-promoting, I'd watch the Dream It Dose. We're on episode like 50 now, and they're all 5 minutes. So you can watch the entire series. If you go YouTube at 1.5 speed, you'll be through the whole thing in like an hour. It's very strong content. It talks a lot about the issues that we've been talking about today. Customers, how much should I raise? What should I do? How do I differentiate? How do I think about competition? What's my go-to-market strategy? We record a lot of those doses, by the way, out of frustration. The frustration is the number of times I want to do a face plant because I see startups making the same mistakes again and again. And it just gets so old. Like, please don't make these mistakes. It's not that hard. So watch that, do reading, talk with other entrepreneurs. I think, Raghu, one of the things you had even mentioned is make sure, you didn't use these terms, but I always think about this. I find most startups don't do a great job at critical thinking also. Like, critically think and criticize your own thinking. Make sure you're not sniffing your own glue, or whatever the right expression is. Be really critical. And also, by the way, find a great co-founder, right? We find most great startups, it's Steve Jobs and Wozniak and Google and even they're all two people. You need somebody, you need a foil. You need somebody to bounce off of that can be the yin for the yang. So be the other thing. If you're looking to find a startup, who's somebody that's probably not exactly like you, but is the opposite of you, so to say, to work on and build a great startup.
Great point. That's why I have Raghu with me, or why he has me with him. That's a great point. Steve, I think we could go on for quite a long time with this conversation, as I have found it fascinating. But we're going to let you go and do your normal business. And thank you very much for joining us, and continue doing what you're doing. It seems to be working well. So thank you so much.
Thanks for having us. Take care.
Take care. Bye-bye.